Hi, this is Kelly. I am going to be performing a lung and thorax assessment on Brandon for my health assessment course at Rowan University.
Hi, I give consent.
Okay, thank you. So I'm going to start by asking you some questions. Just answer them as best as you can, okay? Have you been experiencing any coughing, excessive coughing, any shortness of breath lately?
Nope.
Okay. How about any of those things with night sweats? Okay. How about any shortness of breath when you're around animals or with any foods?
Nope.
Any allergies that you know of?
Allergies, seasonal allergies.
Okay. And do you have any chest pain when you're breathing right now?
Nope.
Okay. Any past history with respiratory infections or breathing problems like pneumonia,
No.
bronchitis? Okay. How about a family history of tuberculosis or
Not that I know
asthma?
of.
No. Do you have a smoking history?
I do not.
Okay. Any environmental conditions that affect your breathing, like work conditions, like being around an environment with smoke or secondhand smoke?
No.
No? Okay. Have you ever had a tuberculin skin test in your forearm that you know of?
I got one this year.
Oh, okay. And how often do you usually get that done?
Annually.
Okay, good. How about chest x-ray for
Never
the
got one done.
TB test? Okay, that's good. All right. And have you ever received a pneumonia vaccine?
I don't believe so.
Okay. How about the flu vaccine?
I get that. I got one last week.
Okay. So you should get that every year, okay? All right, good. So I'll start by looking at your posterior chest or your back. So just turn around for me. Okay, so is it okay if we can just remove your shirt?
Yeah.
Okay, good. Thank you. Thank you, thank you. So looking at your chest wall, I can see how it expands evenly with breathing. It rises and falls symmetrically. I see that it's not, your breathing isn't labored. You're in a relaxed position. Your scapula is evenly placed in each hemithorax. Your neck muscles and trapezius muscles are not hypertrophied or enlarged, which I would expect to see in a patient with COPD, so that's good. Your skin color correlates with your ethnicity. You are dry and warm to the touch. Okay, so first what I'm going to do is place my thumbs on your sides, and I'm going to ask you to take a deep breath as my thumbs are supposed to rise and fall with each chest expansion. Okay, so just... I'm sorry, my hands are cold, I know. Sorry about that. Okay, just take some deep breaths for me. Okay, again. Okay, good. So my thumbs move symmetrically, which is normal. Next, I'm going to check for tactile phlebitis, which are vibrations that are produced with speaking. So I'm going to ask you to say the word 88 when I touch over the fields with the ball of my hand. Okay, so each time you feel my touch, just say 88, okay?
88. 88. 88. 88. 88. 88. 88. 88. 88. 88.
Okay, good, thank you. So I did feel that, so that's good and normal. Is there any tenderness or pain with the areas I'm touching right now?
No.
Okay, good. So now I'm going to start percussing. This is basically a tapping, and it's kind of like, it's like this. So with this, I expect to hear something called resonance, which is basically a low-pitched hollow sound that tells me that you have healthy lung tissue. So I'm going to go side to side in between your ribs. Okay, so next I'm going to take a listen to your lungs. Okay. Tell me if you're feeling any kind of shortness of breath or like it's kind of hard to catch your breath or any dizziness. Okay, you can just breathe normally while I'm doing this, okay? Okay, good. Thank you. So next I'm going to ask you to turn around. I just want to do the same thing on the front side of your chest. Okay. So on inspection, I noticed that you look relaxed in your breathing. I see your chest wall expanding symmetrically with each rise and fall of each breath. I'm just going to do the same thing with my thumbs, and I'm just going to press against each side as you breathe in deeply, okay? So just deep breathe. Again. Okay, good. I noticed that they rose and fell with each breath, which is normal. Okay, so next I'm going to do the same thing that I did on your back. I'm just going to place the ball of my palms on your chest and just say 88 with each time you feel my hand, okay?
88, 88, 88, 88, 88, 88, 88.
Okay, good. Thank you. Okay, so good. That was equal and it was symmetric, so good job. That's normal. Next, I'm going to do the percussion step that I did on your back. All right. Going to go in between your ribs. I hear the resonance, which is normal.
I can't see you.
What?
I can't see you.
Sorry. Thanks. Okay. Do you have any pain or tenderness when I press on your chest? Okay. So next I'm going to take a listen to your lungs again, and I'm going to in particular listen to your right middle lobe. Just breathe normally. Okay, great. So that completes my assessment. Do you have any questions for me?
Mm-mm.
Okay, great. Thank you so much.
No problem.